and Hawaii continues to be amongst the leaders in the country on per capita COVID cases. But today we've set a new record, breaking 3 digits with 109 new positive cases in the last day. This is the first time that we've had and seen more than 100 cases here in Hawaii. This is a new record, and we know that over the past week or so, we have seen higher and higher records set as we've seen more cases here in the islands. I'm very concerned about this surge in cases. I think we all are. We anticipated this happening, and I just want to assure you that our healthcare system has responded, and we continue to have adequate capacity and healthcare in our islands to deal with this increase in cases. But we need to take action to slow the spread of COVID-19. In light of this new surge in cases, I am proposing to the counties and working with all of the mayors to reinstate some of the measures that we've relaxed over the last few weeks. First, we're seeking to limit social gatherings to 10 or fewer. Kauai has already taken this action. We continue to say and note that the Department of Education, University of Hawaii, and universities are excepted from these gathering limitations because of the controlled environments and the cohorting and safe practices that are being implemented in these organizations. Second, I've asked all the mayors to relook at the closing of bars. As you are aware, Mayor Caldwell is looking at closing bars for 3 weeks, and I agree with his request. We are working with all the counties to look at bars and how we might be able to restrict the activities that encourage spreading of COVID-19. We are also looking and working with the counties to limit social gatherings on the beaches and in our parks. We have noticed more cases being generated from family gatherings and other parties in the beach and park settings. We will continue to work with the counties to implement gathering limitations, no more than 10, in all of these situations.
Everyone take a deep breath. We're going to be fine. We're okay. But take to heart what the governor said. Never before have we been in a circumstance where what we do affects our neighbors as much. Never before. So again, take a deep breath. Hospital system's holding. We're doing all right. I'm going to go over some numbers today. As the governor pointed out, we've got 109 new cases today. And we have 624 active cases as of now, as reported by Department of Health. This will have some implications about what I'm going to say going forward. Now, how does that match up to what we've been dealing with over time? In this month, we're here towards the end of July. We've had to date 958 cases in July, and that is a concern. The reason that's a concern is because if you look at what's been going on for the first 5 months of our COVID crisis, from February till June, we had 900, exactly 900 cases in the first 5 months. So this month has exceeded all the months before it. And that's a reflection very clearly of what the governor pointed out, which is that people have been out and about and our social distancing hasn't been up to par. People have not worn masks often enough when they've been around others. That's why it's a very, very wise recommendation the governor makes to go to social gatherings of only 10 or less. That is absolutely critical in my opinion. I completely agree with him. Let's talk about our healthcare system, because I know when people hear these larger numbers, they wonder, will there be hospital beds for my loved ones, for my kupuna? So as of now, we've talked about these numbers a little bit before, we are doing well. We have 122 out of 244 of our statewide ICU beds occupied. That's 46%. Only 15 of this 112 individuals are COVID-19 positive individuals. Again, 15 out of all the people in the ICU. Those are other individuals that we love that have had heart attacks or strokes that are in the intensive care unit. They're there, but a very small number of people with COVID are in the ICU. And we still have over half of our ICU beds available. That means even with a surge, we will have the capability to take care of people, but there will be a limit at some point. People ask, what's the most dangerous thing about COVID? Well, the most dangerous issue is because it's an upper respiratory problem if people stop breathing well, and that's where ventilators come in. We have 459 ventilators in our state available to us. 64 of them right now, as of this morning, are occupied. That's 14%. But once again, only a small percentage of those ventilators are being used by individuals with COVID-19, just 9. Now, this number can go up quite quickly because we often see a lag, a delay, in the time from when someone is diagnosed with COVID to the time they need hospitalization. Let's talk about hospitalizations. In the state, we have 2,773 hospital beds, which can be bumped up if we really need to have extra beds ever. We've never had to do that in a large way. As of today, there are currently 61 individuals, 61 statewide, who have COVID in our hospitals. And to date, for the whole pandemic, we've had 167 hospitalizations. So as you can see, we have a slightly higher number by percentage right now in our hospitals with COVID. Usually that's just getting checked out to make sure that the disease doesn't progress. Maybe they need a little bit of oxygen to support them, and on rare occasions they have to go into the intensive care unit. But this can change very quickly. Historically, about 10% of all individuals that go into the that get diagnosed go into the hospital. So if we have 1,000 cases this month, which we basically have had, we can expect about 100 hospitalizations. And then some of those individuals end up in the ICU or, God forbid, on a ventilator and can pass. Now, to date, we've had 26 fatalities, total of 26. That's 1.8 per 100,000 of our citizens, which is very significantly lower than any other state. That's the lowest rate in the nation. And this is something to be proud of. We should be proud of our nurses and our doctors, our respiratory therapists, our first responders, so many people, and our Department of Health, who's working their butt off to make sure that we prevent as many cases as possible. But these are the expectations. The expectations are that 11% of every case we diagnose will end up in the hospital, and that out of every 72 cases that we've caught with a test, one individual has died. So all of these numbers that I'm sharing with you today are just reflections of the human condition. So when the Gov says, please don't be in large social gatherings at beaches, he's saying, really, don't make Green have to report another surge, or Dr. Anderson report another surge, because some individuals could succumb to the disease, or young people will catch COVID-19 at the beach park, and then when they go home, they will give it to one of their grandparents or parents. And that is where we get into trouble. I'll just close by saying this. We've had this surge now. Do brace yourself a little bit, because the lag is usually 2 to 3 weeks when people need hospitalization, and the average length of hospitalization is 10.5 days. So in Queens or Straub, Kaiser, Castle, when they end up having individuals in the hospital, people can be quite sick, and they can fill up beds, and those beds can stay filled for quite a long time. It's why we have to really be diligent in the coming weeks. Please take to heart the governor's orders. Please take to heart whatever the orders come from the mayor's offices. Whatever we can do to reduce the rate of COVID right now will pay dividends later in terms of lives.
The purpose of this press conference is because of major changes, not changes, but things that have been happening in regards to the numbers of the virus as far as positive. And wanted to make sure that we put out the up-to-date, the correct information, so those are the people that can answer your questions. Basically, let me give you a real fast roundup of what was presented to the public by the governor and others. Very surprising to many, because of the number of 109 new cases since the last report. And that is a lot for Hawaii State. Again, 109 total. I break it down of the 109, there was 98 on Oahu, 9 on Maui, 2 on Kauai, 0 on Molokai, 0 on Lanai, and 0 on the island of Hawaii. Naturally, island of Hawaii, you feel very fortunate that we had 0, but we all know how easily that can be changed, and we all know that we have to be really on top of things to make sure we keep our numbers low. In regards to changes that had been proposed, all of the changes being proposed are just that, proposed. Nothing has been changed since the last. But you're going to start to hear numbers, and that's one of the purpose of this press conference, to emphasize that. At this time, there has been discussion in regards to inter-island, and yes, that is a discussion, but right now, same as yesterday, if you're inter-island, there is no quarantine. If you're from the mainland or outside the state, you will be subjected to a 14-day quarantine. In regards to what we are doing here on the island of Hawaii, we're so lucky to have the fire department in charge of one of the task forces, working with the state and other units of the county government and the private sector and the state sector in regards to trying to follow the basic principle of trying to keep things open as best as we can, trying to work with the bars and the restaurants and individuals of what they can do or should do to help keep our numbers down and under control. And we hope to continue doing that and even more so reinforcing it and even more so to get better on it.